My name is Whittle. I'm one of the Chief Clinical Information Officers at Leeds Teaching Hospitals Trust, and I'm a nurse. And my principal role really is to bridge the gap between clinicians and informaticians to make sure that what we produce matches the functionality required by our clinical teams to deliver safe and effective care. I think from a digital perspective, the biggest game changer has been Matt Hancock and the profile that he's brought to that transformation at a clinical level has just raised our profile beyond belief, really. And through that process has raised the profile at boards of the CCIOs, the CIO role, and how they need to change their culture and lead this transformation. But when we talk about how do we introduce technology into clinical areas, we always say that that transformation doesn't start with technology. It starts with a conversation, and it starts with talking to clinicians about what are their big problems that they want us to help solve. And we then come in and think about what technology is appropriate to introduce. So it should start with the conversation culture. I think that the opportunities are about how we take our staff on that journey with us. We know that the challenges facing workforce and recruitment are phenomenal, and they're not going to change. We've got an ageing population with complex health needs. So we have to take our whole, so in my organisation, that's probably about 9,000 clinical staff on that journey with us to think about how they can change their processes and how they can change to protect that golden hour that the Topple review talks about that interaction with clinician and patient. Shouldn't be about technology. It shouldn't be about, let me just key this information in. It should be a conversation. GS1 standards bring out the right way of working, if you like. It helps us embed the evidence into a set of standards. But what that also allows us to do is identify the patients and pathways that naturally fall out of those standards, because you're never going to get in clinical practice 100% of patients fitting into the same standard. So you have to build in that ability to flex and to be different. The thing about this event that I enjoy the most is the networking, but also seeing the progression. So over a number of years, we've seen the process and the success grow, and more organisations becoming part of our journey, which is fantastic.